People used to tell me I'm possessed, I have demons inside of me. I even went for to bomos and all those kind of people because my mom would think something was wrong with me.
Right.
But I was just sick. And it's like any other illness. Like how people know about cancer. You didn't grow up with family who have cancer,
Sure.
you know, but they are spreading it, the awareness. So in the same way, I feel like they should spread awareness about mental health and make it feel like you're not crazy, you're not lunatic, you're not insane, you're just sick.
Depression, mood disorder, schizophrenia, and OCD. So you have or you had all four. Help us understand, first of all, depression. What is it? What does it look like? How does it feel?
When you have depression, nothing can help you. That was the feeling.
Okay.
And even though you try to do the things you like, you just feel an emptiness and a void. And what was going through my mind when I had a very severe depression was emotionally I was crippled.
Can you spot depression? Like if you were looking at a friend, would you be able to spot depression?
I would able to
Yeah.
through his or her movement, her gestures, and her facial expressions.
Right. Do you think people can hide depression? Can it be hidden?
It can, but it's a very, very hurtful experience.
Let's go into schizophrenia now. It's not something that people hear very much of. So you were diagnosed with that as well.
Yes.
How does that look like? How does that feel?
Well, mine was not considered that serious because I only experienced hallucinations a few times.
Is it a schizophrenia attack? Does it happen only now and then? Or is it something that you suffer with daily?
Not daily,
Okay.
because back then I was still unstable and hallucinations occurred. And sometimes when I sleep, I experience sleep paralysis. People with schizophrenia, sometimes you see them talking to themselves.
Right.
Yeah.
Okay. Is talking to themselves a way of dealing with it, or it's out of the condition that they do that?
It's out of the competition.
Okay. Because I would have thought if you didn't explain it that way, which is really quite illuminating, but I would have thought that schizophrenia means that a person has got two personalities.
Yeah.
Yeah.
On that, right, I also had that problem. I tore a textbook, and this is where people might find the similarity with split personality.
Was there a time in your life that it got so bad that you started looking for therapy, or was it just advice of friends? How did you finally get to a place of help?
Actually, I went for therapy before I went to the psychiatrist.
Okay.
So
What kind of therapy was that?
psychotherapy.
Okay.
But I wasn't diagnosed, and the therapist would, because when you go to seek a psychologist, it's different than a psychiatrist. So they are not doctors, but they are there to give you counseling. So when you go and seek a therapist, it might take longer for them to refer you to a doctor and figure out that there is something wrong with you. But it's a start. But when I went and see the therapist, I hated her so much because there was a lot of things that she was digging, like after every session, I would cry and I felt worse.
Wow.
And after a few months, I just stopped going. I didn't want to go because I hated it. I don't like talking about my past, my pain, and everything. But she did say a lot of things that were true, which I didn't want to admit or I didn't want to accept. So after that, after a few months after that was when I went and see the psychiatrist. And my psychiatrist, actually, he gives me therapy during consultation.
OCD is something sometimes I hear people joke about,
Yes.
They go, oh, you're so OCD la you, so
Yeah.
OCD la you, and then we laugh about it. But it's not a laughable thing, right? It's not a laughing matter.
Actually, I do mind. I don't mind.
Okay.
Yeah.
But what is it? What is OCD?
For me, the kind of OCD I have is checking regularly, and that is the worst part of all of this sickness.
Checking regularly.
Yes. Sometimes I go up to even one whole day of checking my bag, checking my documentations, and that was like the worst thing ever. Apart from the other sicknesses, the other symptoms weren't so significant, but this was taking really a toll on me.
Because it affected you daily, right?
It affected me daily. It affected me hourly.
Wow.
Yeah, and I remember I was checking my locker for 3 hours.
Your locker?
Yes,
Wow. Why?
because of the fear of not locking it properly.
Oh, I see.
So-
in school or in college?
In college.
Okay.
So nobody seems to understand it. Yeah, and to deal with it, there was hardly anyone to talk to.
Right. I've heard people talk about OCD, right? And then sometimes, as I said, they joke about it. But it usually has to do with cleanliness, no? Like when someone tries
yeah.
to arrange something, wipe in a table a few times, yeah, so OCD like you.
There's,
you know?
there's another form of OCD. But for mine was everything must be in place, and it strikes me very hardly as a future auditor when I have to like check, agree documents,
Yeah.
and I felt I wanted to give up. And even when I check my phone for hours and hours, I just don't know who to turn to.
Wow. Why do you do that? Why do you check your phone?
Because I had the mindset that if I accidentally press something,
Or
then
send the wrong message out?
yes. So like it feels very unusual and sometimes weird that even if people hear about this, they don't seem to understand. But it's something that really strengthens me because I have to like break this habit and change it one step at a time.
Yes.
And now I'm all right.
Okay.
Already. I'm totally fine.
So that's how you dealt with it?
Yes.
One step at a time?
Yes.
Probably what do you tell yourself? Because one voice in your head is saying, check it again, check it again. So what is the other voice that helps you in your head?
firm.
Be firm.
Yes.
Maybe
Don't doubt
trust-
yourself.
Don't doubt yourself.
Yes.
Don't doubt yourself. Wow, that's a strong one. That's a good one. Just, I have doubt. I probably didn't lock my locker, but don't doubt. I'm sure you did. Something like that?
Yep.
Maybe even trusting yourself, right?
Yes.
A little bit more.
Yes.
That helps?
That really helps.
So it's almost like speaking to yourself, right? You gotta
Yes.
motivate yourself.
It's like a on-the-spot training for me. Yeah, to train my self-confidence, self-esteem.
Yeah, sure.
Maybe people might think that self-confidence, self-esteem is not that important to them, but it was very important to me.
Wow.
I felt like I had enough. I mean, I don't know what to do. I don't know how to help myself. And I spoke to my friend about it, and she didn't know how to help me either. So I decided on my own that I'm going to go to the government hospital, to the psychiatric department, get help. And I went. I didn't tell anyone. I didn't tell my mom. I didn't tell my dad. I didn't tell anyone. I just felt like I needed to do this by myself. I went. I registered my name. And so you have to see the normal physician first before they refer you to the psychiatrist.
Right.
So the physician will do sort of like a filtration just to know what's going on, and then only he will refer you to the doctor. The physician himself was quite mean to me, I still remember.
Really?
He thought I was high on drugs.
Oh no.
He thought I was on heroin or cocaine or something. I was like, I'm not. Why do I give off that vibe or something? I don't know. And he took my blood, my urine, just to test if I was on drugs. But I think it's a procedure thing because they want to make sure that I don't hallucinate because of that.
Right. Like a SOP.
Yeah. When I went there and I told them, saya nak bunuh diri. And they were like, you gila ke? The nurses said that, and I was quite hurt.
Sure.
You know, I felt like I needed help, and I went there. Then I told myself, maybe I'm not sick, maybe I'm really weird.
Mood disorder is not the same as mood swings, right?
Mood disorder is more like, it's like related to depression,
Okay.
but it's just that your mood is like what the term says is a disorder
Okay. How does it look like?
prescribed by my psychiatrist. So he said that when with mood disorder, right, your your sense of living is so low that you can easily take your life.
Wow.
Yeah, it's closely related to depression.
Okay.
Yeah,
Okay, but it involves your mood, I guess.
yeah. Every single thing you do always amounts to sad feeling.
Okay. So it always ends up to be sad.
Yes, everything you do,
yeah.
even when you try talking to people, the sense of grief will always be so apparent.
I think the stigma of getting help, especially in the Asian context,
Yeah.
it's always about face. How do you think we can, as a community, as a culture, as a nation, work towards overcoming this stigma?
Like, even for insurance companies, right? They don't give you insurance if you have mental health issues. Thank God I got my insurance before I was diagnosed. But I'm speaking on behalf of those who can't get, like, schizophrenia is more, obviously that's a little bit more severe cases. I feel like they are very neglected from certain things or certain privileges because they are immediately categorized under orang kurang upaya or disabled or special needs people. Yeah, they are special, but that doesn't mean that they can't do normal things.
They're not disabled, right?
Yeah, they're not disabled. That doesn't mean they're not capable of doing things that we can do. They might even be better at it.
Right.
So people need to break the stigma of mental health, people who are mentally ill, by knowing that they're the same.
You're letting us into a psyche of people who go through these challenges, and we think sometimes they actually like doing what they're doing, or they
Doing it for attention.
Doing it for attention. But thank you for even sharing that part of, no, actually people do want help. They're probably crying out for help, and they come to a place whereby either they find no help and they say, let's just end it all, or thank God for that strength within you, even though you might think there's a little bit of strength left, but you said, I want this help, I need this help, and I'm going to look for it myself. But then in the midst of that, you also mentioned that there's this stigma, isn't it?
Yeah. All the time. I still that till today.
Yeah. Is that why people don't go to psychiatrists? You think don't go and get help?
Because they think that you're psychotic,
Right.
you're psycho, you
Yeah.
have a problem. I am taking very high dosages of antipsychotics and antidepressants, but that doesn't mean I'm crazy. I can still talk like a normal person.
Yeah, like you're doing now.
Yeah, and it doesn't make you any less worthy of a person. I can still do whatever that a normal person can do.
So how did you deal with depression? How did you try to overcome it?
Well, at first I did not know how to overcome it, and it was a struggle because every night before I go to sleep, I would always feel this pain inside me, and to overcome it physically was to sleep well. Even though that might seem weird for the viewers, but it's true. You have to sleep well so that your brain will be stable in terms of chemicals.
Okay.
In the long term, other than that, you should talk to someone. But make sure you talk to the right people.
Sure.
Yeah.
If you have a problem with your liver, or if you have a problem with your kidney or your stomach, you will go and get medication, and you will go get treatment. You will go and try to do whatever you can just to make sure it gets better, just to recover. And same thing with depression. Depression, bipolar, anorexia, all this has got to do with some sort of chemical reaction in your brain and the imbalance in your brains. That's what I learned.
Yeah.
And it can be treated.
Okay.
You can recover from it.
Yeah.
And going for therapy is a form, or going for counseling is a form of treatment. And there's a lot of medications out there that actually helps. I myself am taking 5 different kind of medications just to function.
Right.
Firstly, I went to the psychiatrist.
Okay.
He's a famous psychiatrist. He gave me sort of a pill, which was very, very hard to endure. When I take it, my sugar level goes down, and I almost fainted.
What does that pill do?
It's supposed to stabilize,
Oh, okay.
stabilize your brain.
Regulate your brain.
Yeah.
Okay. But it has all these side effects, which is
Yeah.
quite tough.
Yes. Apart from that, I've been taking sleeping pills too,
Okay.
and it wasn't easy. It gave me a weight gain.
Yeah. So that's the thing, right? You're helping one condition, but then you're having a tough time with another condition.
Yes.
Sleeping pills with weight gain, and then this pill that the psychiatrist gave you with just sugar level dropping. Yeah. And did you faint? You said you fainted.
Almost fainted.
Almost fainted.
But I collapsed to the
Oh,
ground.
you did? Oh,
yes. So I had to call my father back upstairs.
Right.
Yes.
So did you continue on that pill or not?
It went on for like 2 weeks or more than that. I can't remember.
Okay.
But even for the sleeping pill, I have to take it regularly every night. If not, there will be an undescribable experience of anxiety attack.
Wow. Anxiety attacks.
Yes.
How does that feel?
That is quite hard to explain. It's like you feel like you have to puke, and your hands shiver, your heart trembles, you sweat a lot.
Wow. What's going on in your mind when you have an anxiety attack? Just fear, fearful thoughts?
Fear.
Yeah.
Fear is so apparent.
Thanks for sharing that, because I personally have not experienced that, but to just hear it from you, I feel for you, because sleep sometimes can be taken for granted, right? Everybody goes to sleep, but if you can't sleep and you need help to sleep, you begin to appreciate sleep so much more. And these attacks that you call anxiety attacks, they're real, right?
Yes.
Sometimes people who don't understand might say, "Oh, this guy is just drama," but it's not drama. It's really what you're going through.
Yes.
So these pills help you.
They are more like a necessity.
Yeah.
And it doesn't help when people misunderstand you and
Sure.
and they don't understand you, and it's very hurtful.
Yeah, because they make comments that probably are unnecessary.
Yes.
Yeah.
I even been bashed with a comment saying there's no such thing. And that was a very heartbreaking.
Sure, because people, you first of all, you think, all right, people don't understand you, but then they pass judgment.
Yes.
And then that judgment is cruel.
Yes.
Almost saying like you're acting. You're putting on a show, and you're not, because that's the last thing you want to do. If you could live a normal life, who doesn't want that, right? So that's painful. And so you're dealing with that. You're still on medication
Yes.
Okay.
I take like 4 types of pills,
every day.
every day, day and night.
You said that the diagnosis actually helped you because it gave
Yeah.
you a little bit more understanding. So I think sometimes even not understanding it yourself will cause you to be really, scared, confused. Because as you said earlier, some will say, "Oh, let's go to the BOMO." Some will say, "Let's go." So you yourself are confused. People around you don't even know what they're really doing, but everyone wants to help. And then finally you went for some help and some therapy, and then you found out that, it is and should be viewed as an illness that can be treated and should be treated this way. So you mentioned chemical imbalance. So what did it make you feel finally when wow, I now understand what it is. How did you feel then?
I feel like whatever my past made sense. I was like, okay, so it made sense. I'm not weird. I'm not I finally understood why I acted out the way I did.
Just like a child who has cancer, that child is not weird, isn't it?
Yeah, it's not
just
weird.
A child has cancer.
Yeah, has
And so
cancer.
let's just deal with it as cancer and treat it like cancer.
Yeah.
Is that how you felt?
Yeah, that's how I feel.
So it's quite freeing, right, to understand that, I'm not crazy. It's just part of life. Some have this, some have that, and yours was that you were going through.
Yeah.
And depression was what you went through. And so maybe more people need to understand that, right? I
Yeah.
think that's quite a nice, clear way of saying it. And also, more importantly, how you felt. It gave you freedom, it gave you clarity. And that's I think something that I think most people should start to have an understanding of what they are really going through.
And I feel like parents do not take mental health seriously. I mean, you try to feed them, give them less candy because you don't want them to end up having diabetes. So physical health is so important to you, but why not mental health? It's part of your being.
Yep.
So when most parents just neglect that part, that's when they start doing a lot of things, and they mentally they're sick. So
Right.
when it's not healthy, then it's sick. And the main thing that they should do I'm not talking about like going out there, going for courses and things like that. The main thing they should do is when someone comes up to you, just to listen.
Start there, right?
Start there, just by listening. And if you don't know anything, then you can go and look it up.
That's right.
I'm not saying that everyone is perfect. Everyone
Sure.
doesn't know everything. Even I didn't know about mental illness till I was diagnosed. Being aware of mental health being something very
Yes.
important is
You're right.
something that I feel like they should be aware of.